Hi again, it's Dr. Gillard. Today we're going to go over the pelvis, bones of the pelvis. More specifically, we're going to go over each one of these is called a what? We're going to go over the two coxal bones. This is a coxal bone. This is a coxal bone. Together they make the pelvis. So the first question of the day, what do you call this right here? This angle? Let me hold it so you can see it better. Okay. Now what is this piece of cartilage right here holding the two coxal bones together? Or what's another name for the coxal bones? Innominate bones, or os coxae. Coxal bones are fine. Pubic symphysis right here, piece of fibrocartilage, right? Okay. And I think there's one more thing. Flip it down like this. What is supposed to fill this space right here? That would be the sacrum. So the sacrum would go right in here. Like that. Got it? Alright. I'm not going to work on the sacrum today. I might just let you look at one thing. Notice the articular surface right here. Keep that in mind because we're going to talk about in a minute the articular surface right here. Alright. So, which way's up, which way's down, which way's front, which way's back? How do you figure this thing out? Well, one key is, let's see if you can see this here, this hole. Okay, what is that? Acetabulum. Can you see there's a ring of a horseshoe-shaped piece of smooth bone here? Lunate surface. Lunate surface of the coxal bone. Lunate surface. And then we have an opening right here, down at the bottom. That's the bottom of the horseshoe. Acetabular notch. Acetabular notch. If I go farther in to the center, between the, whatever they're called, of the horseshoe here, what is the horseshoe anyway? That's articular cartilage. Remember the acetabular labrum would go right up around here, which you can't see in this model. Acetabular labrum, and it would go all the way here over this notch. What's that called? Transverse acetabular ligament. Cover here to here. Can't see it here though. Okay, so those are the parts of the acetabulum. Set this back down again. Maybe I can actually zoom in a bit. Let's see. So we don't have to hold it. Good. What's this hole? Well, the obturator nerve and artery come out through a notch right here. Can't see the notch very well. There's a notch right here. That's the obturator groove. This is the obturator foramen right here. So let's go answer the question though. How do we know which way is forward and which way is back? Well, that always has to sit. Let's zoom back out. The acetabulum always has to, the femur is always connecting like this. So we know this is going to be the lateral surface, wherever this hole is. And then there's a couple ways to do this. Alright, if we turn it over like this, trying to figure out which way is front, we can use these two bumps. These always go forward. This is the bump where you get a hip pointer in football. This is the anterior superior iliac spine, and this is the anterior inferior iliac spine. Those always face forward, like this. Or you can think of this big one right here. See this big bump? Turn it different ways. What is that? That's your ischial tuberosity. So you can think of that like the bumper of a car. So that goes backwards. Goes backwards like this. So this is lateral. This is backwards. And so this would be which ala or which coxal bone would this be? Well, if this is backwards and this is lateral, so this would be facing you now. Good. So this is the right coxal bone. Right coxal bone. Let's look at some more pieces here. So this is still this is the anterior here. We have a tubercle right here. Zoom it in again here. So we have a nice little bump right here that you actually palpate on yourself. Pubic tubercle. Pubic tubercle. And then, I don't think this is on your list, but we might as well do this line right here. This is the obturator crest. Obturator crest coming from the lateral side where the obturator foramen is, and it meets the pubic tubercle. We spin it this way. What's this surface right here we just saw? Symphyseal surface meets the symphysis pubis, or pubic symphysis. And that also, well, it doesn't quite meet the crest. Here's the pubic tubercle right here. But this crest of bone between the symphysis pubis and the pubic tubercle, this is the, what's this called? That's the pubic crest. Pubic crest would be right in here. Let's look down at this way, maybe you can see it again. So, obturator crest, pubic tubercle, pubic crest, right here. This little area, right? Oops, can't see that way. Right here. Okay, now let's go look on the medial side of the bone a little bit. Let's turn it over. Okay, now this is the inside. Still the obturator foramen here. Now we have a nice line of bone. If I put it like this, maybe you can see it. See how sharp it is? It's almost like the anterior border of the tibia. And it leads to our spot, again, the pubic tubercle. So this is the pectineal line. Pectineal line. I think you can probably see it best like that. Pubic tubercle. Pectineal line goes and goes and goes, and it turns right about this area. It turns into the arcuate line. Let's keep following it. Arcuate line, and then it lands into this really rough area, which we just saw articulates with the sacrum. And now these are to help hold things together. These little mountains are not supposed to be here. But there's a thing here that looks like an ear. This is the auricular surface. Auricular surface of the, I guess you could say, of the ilium. We didn't even do the parts yet, but let's keep going here. Then all this rough stuff in here, this still articulates with the sacrum. This is the tuberosity of the pubic bone. So if I put a sticker here, or here, or here, or here, anywhere in here, that's the tuberosity of the ilium. So let's talk about that real quick. Let me back up the camera a little bit. Okay, let's get this back in it. So which way is this again, if it's laying here? If I say, is this a right or is this a left? So you know, well, there's the bumper There's the ischial tuberosity, is that nice bumper there. There's the acetabulum, pubic tubercle is there, so this has got to be the right side again, lateral side. You can see this, anterior inferior iliac spine, anterior superior iliac spine is here. But all of this, see all of this bone? This is all ilium. This is kind of the joining place of the three bones. There's kind of a peace sign in here that shows, you can see it in netters, where the articulation spots are. You could actually call this right here, this region in here, the body of the ilium, because this is where the ilium is the thickest and it kind of joins the other bones. This is the pubis area, so this would be the body of the pubis. My fingers are pinching here. So body of the ilium. I don't think that's on your list to know. So this must be the body of the ischium. Body of the ischium. Now this, all of this on both sides, kind of looks like a wing, doesn't it? Like you could fly like a bird. So this is the ala, or this is the, well, you can just call it the wing of the ilium. So we got this side. It's also called the ala. I think that's actually the preferred name. I'll correct that if I'm wrong. My mind just blanked on that a little bit, but I'm pretty sure it's the ala. I know it's, you could call it the wing. That's on both sides. So if what side is this? Are we lateral or are we medial? There's the acetabulum, so this is lateral. So we're calling this part of the ala, we're calling this the gluteal surface. The gluteal surface. Sometimes you can see some gluteal lines for attachment of the different gluteal muscles, but on some specimens it's really hard to see, so I agree with just calling it the gluteal surface. Now if we flip over to the medial side, do we agree we're medial now? Yeah, we can't see the obturator anymore, and we can see the little ear thing, the auricular surface, and we can see the tuberosity here of the ilium. So this smooth part, all of this, that is called the iliac fossa. The fossa of the ilium, or the iliac fossa. Iliac fossa runs right down to that ridge. What was that ridge called? The arcuate line, which runs into the, this one's on your list. Arcuate line runs right into that ridge. Pectineal line finishes at that giant volcano. As some of you know from class, I like to use volcano and mountain ranges to describe this because it kind of pokes up. Pubic tubercle. Pubic tubercle has a lava flow, or a little mountain range running toward the symphysis pubis on the top here, and that would be your pubic crest. Like pyramidalis muscle attaches in there, rectus abdominis. Okay, let's see what else we can see here. We did that. Let's see. Let's do this from this view. This is almost an A to P view, right? Here's the pubic symphysis, or the symphyseal surface would be here. You can see, we can cheat because we see a little hole for the pin attachment. So we're almost looking right at you. Now from this view we can see a little jagged thing here. See that? And then we can see a big notch. So that's the greater sciatic notch right there. It comes into a bump right here. That's the posterior inferior iliac spine. And if you go up, you see another big important bump right here. Good. That's the posterior superior iliac spine, which is an important chiropractic contact. Let's look at it from this view. It's right here. And this view, that's right here. Posterior superior iliac spine, PSIS. Posterior inferior iliac spine, And how do you know where that is? Because right inferior to that you drop into this giant notch, and that's the greater sciatic notch. And that's where, well, guess what comes out of that? That's where the sciatic nerve, amongst other things, passes. You should know the things. I know we don't do it in class, but I think we should. You should know the structures that pass in and out of the greater sciatic foramen. Once you get ligaments over this, it turns into a hole called the foramen. As well as, this would be the lesser sciatic notch here, because this is going to be blocked off with ligaments as well. In fact, we should know those ligaments. Right? What are those? What's the ligament? Oh, did I tell you what this is? Greater sciatic notch. This is the posterior inferior iliac spine, and the bottom of the greater sciatic notch, that's the ischial or spine of the ischium or ischial spine. So let's look at that for a second. It's right there. So that's where the sacral spinous ligament connects. Sacral spinous ligament connects right there. And there's the lesser sciatic foramen, right? Would be, or it's a notch right now, but once you connect the sacrospinous ligament, what's the other one? Sacrotuberous ligament, which connects down to here. What's this again? Ischiotuberosity. Then it makes the greater and lesser sciatic foramen. Know the structures that come out of that. Hopefully you're getting that in your lecture part of the class. Okay, so medial surface or lateral surface, where are we? Okay, I don't see a hole here, do you? The acetabulum would be on the other side of that, and there it is. So we're medial surface. What's this? Pectineal line, good. Arcuate line, auricular surface, good. Pubic tubercle would be right here. Now let's talk about these pieces here. So the arcuate, or not the arcuate, the arcuate line's here, but the pectineal line, that actually runs over this piece of bone, which you can get fractures through. So you need to know this. This is the superior, or you tell me what it is. Let me give you a second. So this is the superior pubic ramus. Superior pubic ramus. All of this. Right here. From the outside, if we're looking kind of at a side view, superior pubic ramus. All of this. Superior pubic ramus. It's a good view to look at. Are we lateral now? Yeah, there's the acetabulum there. Acetabular notch is here. So if we drop right below it and I grab this part of the hole, what's this? Inferior pubic ramus, superior pubic ramus, inferior pubic ramus, and then what about back here? This makes up part of a hole, where my thumb is. That's the ramus of the ischium. So ramus of the ischium, inferior pubic ramus, superior pubic ramus, and good. We got the obturator foramen kind of covered then. Because you need to describe fractures in these, or pathology, you need to know that all these terms. Together you'll see in books, this is the ischiopubic ramus. They often just name the whole thing ischiopubic ramus instead of inferior pubic ramus and ramus of the, ischioramus, or ramus of the ischium. What's this now? That's where your hamstrings connect, right? Ischiotuberosity, all of this. It's big connections. Okay, did we get everything? I think we got everything we need to get. Let's kind of, let's put it back together. That looks a little better, doesn't it? It looks a little more familiar to you. Let's do one more thing if it'll hold here without falling. Let's see if you can see this now. What's this? That's the auricular surface. So that's where the SI joint, the main connection, the auricular surface of the which bone? The ilium. And this is the tuberosity. All of this is the tuberosity. The whole thing here, that's called the pelvic inlet. Better to look in netter, you can see that better, but this is all pelvic inlet right here. Okay, hope that helps, and good luck with your midterms.